Hi guys, today I will talk about the topic blood pressure. First, blood pressure means measurement of the pressure of or or force of the blood inside our arteries means blood pressure. Each time our heart beats, it pumps blood through arteries that carry blood throughout our body. This happens 16 to 100 times a minute, 24 hours of a day. Artery deliver oxygen and nutrients to our whole body so it can function. Blood pressure both versus heart rate, both of these have to do with our heart, but but they are two different things. Blood pressure is how powerful our blood travels through the blood vessels, and heart rate is number of the time our heart beats in a 1 minute. In increase in heart rate doesn't mean thus means our blood pressure is going up too. The only way to know our blood pressure is to measure it with a blood pressure. uh, why blood pressure fluctuation? Our blood pressure doesn't stay the same at all times. It changes based on what you are doing. When you are excessive and excited, our blood pressure go up. When you are resting, our blood pressure is go lower level. Our blood pressure can also change because of our age, medication you take, change in position. Why blood pressure matters? High blood pressure is the silent killer. Usually has no symptoms. It can damage our heart, kidney, brain before you know anything is wrong. High blood pressure is major risk factor of cardiovascular disease. Without treatment, high blood pressure can cause some disease like heart attack, heart failure, stroke, heart peripheral artery disorder, kidney disease, broken blood vessels in our eyes, etc. Why it is who it is risk of the getting high blood pressure. Your risk of the high blood pressure is higher if you have a family history of the high blood pressure, cardiovascular disease or diabetes, are age 60 or older person, have high cholesterol level, obesity, have the diabetes, daily use of the tobacco uh, products, do not work, exercise, eat foods like high fatty that are the high in the salt, etc. When is blood pressure checked? Our healthcare provider should check our blood pressure at every annual checkup. If your blood pressure is normal, if your blood pressure reading are high at your appointments, you provide may ask you to check our blood pressure at home, everywhere, from several times a day at once a week. You should take blood pressure readings at the same time of the day each time. You can take 2 or 3 readings one after the other as long as you wait 1 minute before the next one. Whenever done, figure out of the average of the 2 or 3 readings you took. Our provider may ask you to wear a blood pressure monitor for 24 hours. The monitor is usually set to take blood pressure every 50 to 20 minutes. High blood pressure is a major risk factor of the cardiovascular disease. Without treatment, you can have a TIC, transient ischemic attack, or stroke, heart attack, a large attack, heart failure, peripheral vascular disease, kidney disorder, and broken blood vessels in our eye. Treatment include making changes recommended by our healthcare provider. Medication and follow-up care. Take a medication as the prescribed. Do not stop or starting taking any medication without taking to our doctor consultation. Blood pressure medications does not keep working after you stop taking it. Some over-the-counter medications such as the decoction can change the way of our blood pressure medication work. Keep all follow-up appointments so your doctor can monitor our blood pressure, make any needed changes to our medication, and help manage our risk of the cardiovascular disease. Our doctor may ask you to record our blood pressure at home. Follow, follow our doctor's instruction for regarding your blood pressure. The blood pressure reading has the two measurement: systolic blood pressure, the top or first number, or diastolic blood pressure, the bottom or second number. The systolic blood pressure, this is pressure in our arteries when your heart is beating and sending blood into our arteries. And second is diastolic blood pressure, the bottom and second number. This is the pressure in our arteries when your heart is to rest between heartbeats. Provider give the measurement as millimeter of the mercury, mmHg. They started using this measurement when instrument to measure blood pressure count mercury. Thank you.